Mr. Gardner. My name's Marina. I'm your nurse and we're going to be going over your discharge instructions. I see we also have your wife here with us. Now we've already went over education for your new diagnosis of high blood pressure and diabetes, and you have both voiced your understanding of the dietary management for those as well as blood sugar monitoring. So now we're going to move on to your medication teaching. So we'll start with the two home meds that you were already on prior to coming to the hospital. So you were taking your Synthroid for your hypothyroid. So we're just going to review that a little bit. You know, this is taken once a day in the morning on an empty stomach, usually 30 minutes to an hour before breakfast. So you should also limit your dietary intake of soy and fiber and avoid grapefruit juice, as these foods and drinks can interfere with how the medication works. You're also going to need to be sure to keep up with routine blood work with your doctor and expect that your dose may change based on your lab work. So you may see this as Synthroid or levothyroxine. When you're picking this up from the pharmacy, that's just the brand name and generic for the medication. This does come with some side effects that you need to look out for, such as hot flashes, sensitivity to heat, sweating, headaches, feeling nervous or irritable, and nausea. If any of these worsen or you become concerned, feel free to reach out to your provider. You will need to call the doctor right away if you have any changes in your mental status, you know, with how you're feeling, talking, or behaving. If your skin is cold or clammy to touch. Ma'am, if you feel your husband seems disoriented, you would want to reach out to his doctor. If you have a fast or weak pulse, which we'll go over that when we discuss your blood pressure medications, how to assess that, or if you feel lightheaded. So for your GERD, you are also taking Protonix at home, which you may also see as pantoprazole. And this helps protect your stomach and your esophagus from the acids in your stomach that may back up when you're having reflux. So these will also help protect the inside of your stomach from potentially developing ulcers. So you'll want to take this on an empty stomach 30 minutes before breakfast. Some side effects include having a headache, nausea, diarrhea, gas, or dizziness. Call your doctor right away if dizziness does not subside. If you have increase in GI distress, if you have a fever, skin rash, or any changes in your urination habits at home. So moving on to your new medications, you are not on these prior to coming into the hospital. So we're going to start with your metoprolol, which you may also see as Lopressor when you pick it up. So this is a medication to treat your high blood pressure, and you see I've also printed this stuff out for you to take home. So you're going to want to take this at the same time every day, and you're not going to want to skip or double up on doses. If you miss a dose, take it as soon as possible as you notice, but if you're getting 8 hours before your next dose is due, then just don't take it. I'm going to teach you and your wife how to check your pulse and your blood pressure. So to check his pulse, you're going to want to take these two fingers on the inside of the wrist, the same side as the thumb, and you'll feel, don't press too hard until you find, you feel the pulsating. It'll go bum, 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 bum. And you will count for a full 60 seconds. Each bump is a beat. And whatever number you get in 60 seconds, that is the heart rate. So you'll want to monitor heart rate and blood pressure once a day. So you'll use the blood pressure, the automated blood pressure cuff. It'll go around the wrist, and the instructions are very specific in the packaging, so you just want to follow that exactly, or the number may not be accurate. So you want to avoid excessive amounts of caffeine, like in coffee, teas, or sodas. So now, since you also have a new diagnosis of diabetes, you want to be really mindful of checking blood sugars, because metoprolol can sometimes mask symptoms of low blood sugar. So you want to be really diligent about keeping an eye on that. And if you start to feel, cool, clammy, dizzy, make sure you check your blood sugar as well. Keep an eye out for drowsiness. You won't want to start driving on this new medication until you see how you react to it. And also change positions slowly, because you may get dizzy, when you stand up. And you want to call the doctor right away if your pulse is slow, you have difficulty breathing, if you have lightheadedness, confusion, sore throat, or if you have any bleeding or bruising. You are also going to be taking lisinopril, which you may also see listed as Zestril, which is also for blood pressure. You're going to want to drink plenty of water, as you can really easily become dehydrated on this medication. Also monitor the heart rate and blood pressure like we discussed with the metoprolol. This can be taken with or without food. And you may need to come in for lab work to just check how your kidneys are working and how certain levels in your blood, called electrolytes, are doing. And you're going to keep using both of these blood pressure medicines even if you feel good, because high blood pressure doesn't always have symptoms, and you want to make sure it's under control. Yes, exactly. So you're going to want to call your doctor right away if you have vomiting or diarrhea, because like I said, you can become really easily dehydrated, and dehydration can affect your blood pressure, and we don't want to drop your blood pressure too low. So for helping manage your new diagnosis of diabetes, in addition to the things we went over prior to this medication teaching, this medication, metformin, you may see it as glucophage, is going to also help manage your blood sugars. And you're going to want to take this twice daily, once with breakfast and once with dinner. So you want to take if you happen to miss a dose, take it as soon as you realize that you've missed it. But if it's getting close to the next dose, do not double up on the doses. You want to, again, be mindful of how your other medication, metoprolol, can mask low blood sugar. So you're wanting to kind of keep a close eye on your blood sugar. Now this can cause a lot of GI side effects that can be uncomfortable, such as bloating, stomach pain, gas, indigestion, constipation, heartburn. You may also have some muscle or joint pain. Definitely call your doctor if you feel like those are becoming, difficult to tolerate. And call the doctor right away if you have any chest pain or rash. Before you have any surgeries, you're going to want to let your doctors know all of these medications that you're taking. And you may also want to get a pill box to help make sure that you don't forget any of your medications and that you're taking them regularly on a daily basis. Do either of you have any questions? All right, well, I've got all this information printed out for you, so you can take this home. All right. I do have my badge, by the way. My badge real broke. And that is our video on medication teaching.